You barely get started, and it's already over. Premature ejaculation can leave you feeling frustrated, embarrassed, and even ashamed. But what actually causes it? Is it physical? Mental? Can you fix it? Today we break it all down, no shame, no myths, just real answers for men like you. I'm Dr. Zoe Hartley, and on this channel we talk openly about men's health over 50, especially the stuff nobody wants to talk about. Premature ejaculation, or PE, is one of the most common sexual issues for men of all ages. In fact, up to 1 in 3 men deal with it at some point. But most guys never bring it up, even with their doctor. So what exactly is premature ejaculation? Clinical definition: ejaculation that happens within 1 minute of penetration, nearly every time, and causes distress or frustration. But it's not just about time, it's about control. Some men last 3 minutes and feel fine. Others last 5 and feel ashamed. The real issue is feeling like you can't control it, like your body takes over and you can't stop it. Let's start with the brain, because that's where this usually begins. 1. Performance anxiety. Worrying about how long you'll last makes you tense, and tension speeds things up. The more you fear it, the more it happens. That creates a loop. 2. Early conditioning. Many men learn to climax quickly during teenage years, for privacy or fear of being caught. That habit can stick even decades later. 3. Stress, shame, and guilt. If you're constantly under pressure, not relaxed with your partner, or ashamed about sex, your body rushes to finish before your mind is ready. Here's the good news. PE is highly treatable, once you understand what's causing it. 1. Behavioral techniques. Start-stop method. Stop stimulation when you feel close, wait, then start again. Squeeze technique. Gentle pressure under the penis head can delay climax. 2. Therapy or counseling. If anxiety or shame are involved, talking to a professional can help you break the mental loop. 3. Desensitizing products. Numbing creams or condoms can reduce sensation just enough to buy more time. 4. Medications. SSRIs used for depression are sometimes prescribed to delay ejaculation. Always talk to your doctor first, especially over 50. If you've been blaming yourself, stop. PE is not a character flaw. It's a combination of habits, emotions, and biology, and it can be improved. The key is to talk about it, get the right help, and stop suffering in silence. Remember, sex is not a performance. It's a connection, a skill. And skills can be learned at any age. If this helped you, leave a like and consider subscribing. And check out our next video. Is it normal for my penis to curve? You're not alone, and the more we talk about it, the stronger we all become.